So we found out that two specific inflammasome-related genes, i.e. AIM2 and heat shock protein 90AB1, like higher expression of these genes were associated with worse progression-free survival in patients who undergo radical prostatectomy. And also when we did Cox regression multivariable analysis and like controlling for confounding factors, we saw that higher expression of these two specific genes was associated with short time to metastasis. So we think that like these two genes can play like a significant role in the oncological outcomes of these patients. Yes, so we did this study like in two phases. The first phase was assessing the expression of the like 33 specific inflammasome-related genes in the Decipher grid registry, which includes more than 52,000 prostate biopsy specimens. And because the database doesn't have like the long-term outcomes, we did the survival analysis on a like real-world radical prostatectomy database, which called the META, which includes 855 prostate cancer cases who underwent radical prostatectomy. So we did a survival analysis to assess the effect of these genes, and as I mentioned before, we found out that these two specific genes, i.e. the AIM2 and the heat shock protein 90AB1, was associated with a worse progression-free survival. But we already know that there are like several factors that can affect the oncological outcomes of these patients. And the main like factors are like pathologic factors, for example, Gleason grade or like margin. So we did a like Cox regression analysis and we controlled for those confounding factors. But again, even after like that, the association was still like significant, and it was associated with a short time to metastasis among those patients. Yeah, this is a great question. So we think that these inflammasome-related genes can be used like as a prognostic like biomarkers in patients with prostate cancer. But most importantly, in future, actually, the long-term benefit of these genes is that we can like find some novel immunotherapy medications that can target these genes, and it can help actually to like optimize the management of patients with prostate cancer, specifically those who are like resistant to like other types of medications.